Right, I'm going to start recording this now. Okay, so let's have a look back to the letter. I'll turn on the share. Here we are. Can you see it? Okay. Run these sessions every day, every single day? Well, we'll see. We'll see how that goes. Maybe I have time this week. So let me just get this out. Manage participants. So if you raise your hand here, I can turn your microphone on. And okay, so let's continue. I'll put this over here. There we go. So not too bad, not too bad. So let's have a look at this next one. Dr. McCarthy, Mr. McCarthy, age 82, I'm writing in regard of, and we probably say regarding, as in concerning. Writing regarding Mr. McCarthy. Okay, he's being discharged today after acting the amputation of affected diabetic foot. His foot was a diabetic, or it was caused by diabetes. Can he have a diabetic foot? Well, I don't know, perhaps someone can advise me. I would appreciate if you could continue with further care into your facility. Good, so we have a direct reason for writing. So, Mr. McCarthy, rational vascular disease, okay. Worth mentioning that he's been non-adherent to his medical activities without assistance. Okay, sounds good. Admitted with the diabetic foot, the particular foot. Now, unless we know which particular foot, I would be tempted to use indefinite article here. It says right below knee, but with the diabetic foot, the particular foot. Okay. Examination of right foot appeared gangrenous with pus, spot culture. Bit of a short sentence there. Gangrenous pus. I would join that. There's no point in having a very short sentence. So examination is right foot appeared gangrenous pus, and his blood culture showed gun positive. Don't know, is that Coxy or Cossy? I don't even know how you say that. Therefore, he was commenced on IV antibiotics. Therefore, okay. You've got to watch using these, though, these discourse markers, because it usually means as a consequence of. But if it's just something that happened afterwards, subsequently, is better. Okay, he was commenced on antibiotics, underwent right, okay. After successful surgery, after a successful surgery, doesn't really matter. I'd be tempted to, I'm always tempted in doubt to use an article. So he was switched on with pain. How can you switch to oral antibiotics along with pain management? What does that mean exactly? He was switched to oral by antibiotics along with pain management. During hospital course, he wanted to assist with good nursing care in terms of management and activities. Oh yeah, that's a good sentence, yeah. Hospital course, hospital stay. I don't know about using course. During the course of his stay, what's that? Question. Surgery is countable. It can be. The surgery was uneventful. That is countable. I don't know. Some people would say that surgery, some think it's countable, some people think it's uncountable. It's the same with team. Some people think that a team, because it consists of a group of people, is plural. Others would argue that the team is considered a unit. So it depends. It doesn't make a lot of difference here. Now, I know what you are asking, that surgery is usually an abstract, and an operation is countable. But I have seen lots of people using operation and surgery interchangeably. So I don't really know if it makes a lot of difference in this case. I know what you are asking. A surgery, is it an uncountable noun? Is it an abstract, a concept? And operation is a noun which can be counted. But again, I have seen some instances where it's been used interchangeably. If in doubt, make it operation as countable and surgery as uncountable. Okay, he underwent after a successful surgery, or if you want, operation. He was switched on by nursing care during his hospital stay. Still, of course, with my to the system of nursing care. Okay, I'm glad to mention. Why would you be glad to mention? I am glad to say is better, I think. Not I'm glad to mention. I'm glad to say. Oops. Space. He still to shut down. The pain management continues. Supposed to follow the vascular surgeon. What? So he's going to walk behind a surgeon after 2 weeks. So he's supposed to have a follow-up. Have a follow-up. I mean, you could use a follow-up as a noun, well, as a noun phrase, or if it's going to be a phrasal verb, then you would have to have a follow-up visit or follow-up consultation. It depends if you want to use it as a noun or a phrase, or if you want to use, or if it's a phrasal verb, then you would have to have a follow-up. So if it's a noun, a follow-up with, or if it's a phrasal verb, a follow-up visit stroke consultation, whichever one of those you want to use after 2 weeks or in 2 weeks' time. Question from Dr. Rashid. Doesn't matter. You can say, I'm pleased, I'm glad, I'm happy to say. You can use either. I'm happy to say, I'm pleased to say, I'm glad to say. You can use either one of those would do fine. Due to the above, I am concerned. Why would you be concerned if he's going to a nursing care home? Why would you be concerned? If he was going home, you might be concerned that his needs might not be met. But if he's going to a nursing home, why would you be concerned? Unless the nursing home is a bit rubbish, in which case you would be well to be concerned. But I don't think we would say that. In view of the above, I am discharging him to your care or something, but I don't think we would use that. Maybe evaluated as fit for home nursing or long-term care facility. Okay, to contact me. Okay, so not so bad. I wouldn't use that. That doesn't quite work. But apart from that, not too bad. Not too bad. Again, if you want to use surgery, some people use it as a noun, some people use it as an uncountable abstract noun, some use it as a countable noun. The surgery, or if you want to, be certain, make it an operation. Okay, now, so do we have any questions? Anybody got any questionage? Put your hand up and I'll turn your microphone on. If anybody's got any questions about this, then we'll move on to the fourth letter and final one, because I only got 4 today. Anybody got any questions? You can either raise your hand, I'll turn your microphone on, or nudges. Where are you? Where are you? Ah, here we go. Hello, hello.
Hello. Hello, how are you?
Not too bad, not too bad.
First, thank you for your advice and support during this session. And I really appreciate your help. Okay. My question is not regarding this writing. I have an overall question regarding writing. Shall I ask my question?
Well, if it's, is it about writing in general?
Yeah.
Oh, sure.
My question is that when we are writing a paragraph, should each paragraph be in one tense? I mean that when, for example, when we say that on today review, she came to my clinic with complaint.
It depends, obviously.
Can we combine present and past with each other? For example, when we say that she came to my clinic with these complaints, after that we can we say that her exam results have shown something, or all of the sentence should be in past?
Right. Well, it's difficult to say without having a particular example of a text. What I would say is that your paragraph needs to...
When I'm writing my writing, for example, on today visit, her mother reported that he had developed these symptoms. So after that time, because I knew that her mother mentioned that he had developed these symptoms,
it's
I write all of my writings in past, but I'm concerned regarding the matter of, because if I write in past, it means that I have forgot that these problems are still relevant. So what
depends. It depends. I mean, right. So the first thing, your paragraphs must not be confusing. So you need to group either one particular period of time or one set of issues into a paragraph. So you don't mix the medical history and the social. You have, separate paragraphs to avoid confusion. Now, again, without seeing any particular text, and it's difficult to just speak about this in an abstract way. What you have to bear in mind that you are writing a letter now, so you can use present tense to describe what you are talking about now, but the events or activities were in the past. So in a paragraph, you could say something like, I am writing to inform you about the...
No, my question is just about today visit. When you write about today visit, shall we write this or examination and everything in past, or we should write in present because still the patient has these problems and also has these symptoms? So would be in past or present?
It depends. Look, unless you can have some particular kind of a text, because there's lots of different ways that you could explain this, right? So it depends how far back. So, say for example, your patient just walked out of a surgery. So that's the recent past. So you will be writing at the time because it is recent. It's only just been finished and completed. So probably then the simple past. And also it depends on the context. So if you say that she's just So on presentation today, you don't have to mention the date because it's today. We can see the date at the top of a letter. So you could use present perfect, simple past, depends on what you want to say.
Okay.
You would use a mixture. You would probably be using past perfect if you've got two past actions and you want to say which finished first.
Is it correct to use past perfect in today video, for example, saying that her mother reported that she had developed these symptoms and also saying that she had been experiencing these symptoms in today's visit?
Well, again, it depends on the context.
Okay.
I can't. Look, I don't want to be, off hand, but unless you've got some particular examples and sentences, and say, okay, here's a sentence.
Okay.
Here's the context, the overall kind of context. Is this correct? And I could say yes or no.
Okay.
It's kind of hard for me to say now without any kind of example.
Okay, sorry, I will find example and ask
If you have some, yeah, I can test,
Thank you.
But right, so what you would, and also it depends on the task. If you are trying to establish a chronology, right? If you are you're telling a story.
Sure.
So you are writing to some person, you are explaining how a series of events led up to what you want them to do. It's a story, it's a timeline. So you would use different tenses in the past, present perfect, past perfect, maybe past perfect, continuous, maybe past continuous. Again, it's difficult to say without some example. Or if for a particular task you had to write about the main issue first because it's urgent, then you would put some supporting ideas as evidence after that, after the main issue, which is urgent. I want you to do this now because this happened and this happened and that happened. So it's, again, it depends on a task. Are you establishing a chronology? You're telling a story? Are you wanting someone to do something? I need you to do something right now because this, and then give some supporting information. So, and it depends also. So if you do have any particular examples, and also, right, if you're taking language out of context, like a sentence, without us seeing the rest of the picture, it might not be correct. It might not be exact. I mean, for example, you would, using the simple past, you would have to have some reference to when the past action occurred. Yeah. However, if in the paragraph before it, you mentioned what the time was, so it's obvious from the context, so you don't need to say it again. So if you took that sentence out of context and said, is this correct or not? Most people would say, well, it doesn't tell you when, so it's not a simple past. But if in the sentence before it, there was a reference to a point of time, it would be correct. Okay. So you've got to be careful taking sentences out of context. It's all about the overall picture, a message.
Yeah, I understand that.
Yeah.
Thank you.
Okay.
Thank you.
That's okay. So let's see what else we've got then. So nobody else seems to have their hand up. So we'll move on to the final letter of the day, because I only got 4. And then we'll see. Did anybody else put a hand up? No. Oh, hang on. Dr. Seba. Hello. Dr. Seba. Oh, hang on. Your microphone. Let me. Oh.
Hello.
Hello.
First of all, thank you, Dr. Kevin, for this great It's really very helpful. Second thing I would like to ask you, could we do we need to mention the name of patient in each paragraph?
Well, you mean like at the start, like
Yeah.
today,
We just can write this
Mr. So-and-so
patient.
came. Well, in strict terms, no, because we know who you are talking about.
Mhm.
If you look at some of the guides, it does suggest that you mention the name at first, and then afterwards you use a pronoun: his, her, she, him, etc. But if we look at this example here, I mean, we don't really need it because it's obvious.
Okay.
It's obvious who you are talking about here. So, Mr. McCarthy, he, his, okay, Mr. McCarthy, he, his, blah, blah, blah. So we don't actually need it here. He,
Okay.
stable, we understand perfectly well from the context who the author is referring to. You can do, but if it's obvious from the context, there's no real need.
Thank you. Thank you.
Okay. Anytime. So let's see what else we've got then. Author. Somebody wants to say, can we use to and in a sentence? This is the question. Yeah, it's called a parallel structure. So if you use it in clause 1 and clause 2, then you would do, because it's called a parallel structure. Can we use to and the sentence? That to and the sentence in second paragraph. Let me have a look. Which one are you talking about? A second. What is it? This? Was it this one? I can't see it. So let's go on to the final one. I'll turn the microphones on at the end, and then you can have some general questions, general talk about this, if you've got anything to say. So, age 82, wanting to refer Mr. McCarthy to your care, discharge today, uneventful recovery, further provision. Okay. I don't know why people keep saying this, highly appreciated. Why do people keep using such adverbs? Highly, greatly, why, would be appreciated, or I would appreciate it. There's no real need. I mean, these people you are writing to, they're not doing you a personal favor. They're doing their job. They're supposed to, that's what they will do in any case. They're not performing you a personal favor. So there's no real need to say, would be highly appreciated. Just say, I would appreciate it. That would be fine. If you want to use it, you can do. All I'm saying is that, they're not doing you a personal favor. They're doing their job, what they get paid for. So there's no need to, I would be so grateful if you would do your job. I would be highly appreciative if you do what you are being paid for. Would you really, I wouldn't say that. So that's just a personal point. Being diagnosed, impairments, it's my primary carer. Have we seen this once? All right. Initially, Mr. McCarthy was admitted with a foot wound for autism septicemia. I was coming so made good. Yeah. Currently vitally stable, or his vitals are stable. Vitally stable. It depends. To the casual reader, vitally stable, or his vitals are stable. But I don't know why that's being made into an adverb. With a healthy wound, therefore he's being discharged today. Okay, regarding his discharge plan. Mm-hmm. Need a wheelchair, reduced mobility. Now, I mentioned this in a video this morning. Somebody wrote he has reduced mobility due to having his amputation. And I thought, well, if you cut off somebody's leg, then I would expect their mobility to be reduced, you know, just a little. So if it's obvious, you don't really need it, you know. Due to the fact that we amputated one of Mr. McCarthy's legs, he's going to need a wheelchair. Really, doctor? You don't say. So if it's obvious, you know, you don't really need it. Demon just feeling posture change. Yeah, good. Section. See posture. Instead of simply having that, something like also dairy wound dressings. What you say? Yeah. Instead of just saying he needs, or he also. So also he like needs, or maybe better, put it in the second position. He also, yeah, that is better. Got a suggestion. His vital signs. Okay, I'll take that on board. And his vital sign and his vital signs are stable, or currently don't, you know, they either are stable or they are not. Vital signs are stable. Very good. We're healthy wound have been discharged today. Taking all this for visit with surgeon. I see. Good. We use it as a phrasal verb and we have a noun afterwards. Excellent. That's pretty good. Pretty good. Not bad. Not bad at all. Very good. Not a lot to change with this one. Excellent. In fact. Very good. So let's. 10 minutes left. So, lower hand on mute. So I'm going to turn everybody off. So.
I want to request me to please join us if you can.
We'll see how it goes. If it's too noisy, I can hear the kids sound.
The second thing I want to ask you, do you have can you give us
So good.
how many mistakes we did?
There's too much background noise. Far too much. So, Yusuf, Mohammed, we turn yours on. I'm trying to. Okay.
Yeah. Hello. Yeah. I would like to ask. Hello.
Yep.
Yeah. The reason why we are writing any later, the purpose of the task, should we mention specifically or just mentioning management is okay? Because sometimes they are asking a specific reason, like physiotherapy, nursing care.
I understand what you mean, and I always I change it to whatever that verb is. So if they want you to assess, assessment. If they want you to evaluate, evaluation. If they want you to advise, advice, inform, etc. Because
like
management
in this
doesn't really mean anything, does it? Yeah.
Yeah. In this particular case, they mention about the physiotherapy and skilled nursing care for the reason for referral.
Yeah, but you know that is pretty explanatory. Your further a provision of care, that's pretty explanatory. But in terms of what you say, yes, I would always look what the verb is. What is it asking you to do? Well, verb of a noun. What's it asking you? Is it asking you? Sorry. Are you asking them to advise. I am writing to request your advice for etc. etc. What was the other one? Evaluate or assess. I am writing to request that you urgently assess Mr. So-and-so, etc. That's is better than simply having a generic, I am writing to your further management. Again, if you want to stand out, don't use them. Because that's what everybody uses, you know? And always, you know, go into the task. What is it that you want that person to do? And tell them in, you know, in sentence one, why am, so, you know, you receive a letter, you want to know, why am I reading this? What is it that you want me to do exactly? They want you to inform, advise, assess, evaluate, control, manage, etc. And don't forget also, this is, you know, at the end of the day, it's an English test. So showing that you have the ability to paraphrase is obviously a good thing. Instead of using the same expressions everybody else does, your further provision, your further management would be highly appreciated. That's what everybody says. If you want to stand out, use something different.
Default setting.
Show some different phrases. Show some different, you know, it's a vocab test. Show some originality. That's what I would say in any case. Okay, Dr. Mubi has got a hand up. We'll have a, let me turn on your mic. Can you hear us?
Yes, yes. Thank you very much for giving me a chance again. I want to ask on behalf of like other candidates from my group. I want to ask, first of all, as your approach is very much realistic towards OET, I am observing by your opinion. So how we should go for this? How we should start for writing practice? Or if we are in the middle, how we should turn ourselves? What is the good way to prepare for writing for OET? And second, like how many mistakes we will do and we will be out of grade B?
Well, I wouldn't even consider that. That's going about it from the wrong direction. What you want to do first of all is, as I said, imagine you are receiving this, right? That's the first thing. What does the task want you to do? And then if you turn it around and think, okay, this person is writing to me, what do I need? What would I need? What would be the most important things? What would be the order? What would I need to do my job receiving this? That's what you need. That's what you should always do. Right? So you are the surgeon, you are the care home, you know, what would you need from a letter? What would you want to know right from the start? And that's what you need. Think about. Now, in terms of grammar and vocabulary, the only thing that you can do there is get some native or teacher to take a look. Maybe you're making the same grammatical mistakes over and over. I see some people and they're making the same mistake, that they're using simple past or present perfect or vice versa when they should use it the other way round, or they're not using relative clauses, or they're missing articles. So what you need first is assessment. Get somebody to take a look and tell you what your main grammatical and vocab mistakes are. Then you can work on correcting those. And the second big thing that I see is people adding irrelevant information. As I say, I read a couple of letters first timers, I read a couple of letters a few days back, and there were over 300 words. They put everything in, including the kitchen sink, to use an English expression. So you need practice. You need somebody to tell you what your mistakes are in grammar terms, in vocab terms, and try and eliminate those, and then look at it from the other way around. What would I need if I were receiving this? What's the most important information that I would need to do my job? And everything else will follow. That's the first thing that I would do. Now, we only have about a minute left, 1 minute 40 seconds are there about. So I'll go back to the group in a second. I recorded both of these, so there should be 2 videos to come. I'll probably put them on YouTube because it's easier, and I'll put the links in the group, and I'll put the file of the letters here. I'll save it. I'll save all this, and I'll post this into the group as well, and you can have it. So there's only a minute left. I don't think we've got time to answer really a question in less than a minute. So if you do have any questions, we can go back into the group on Telegram, okay? And you can ask me then. So that should be it. Turn that off.